Well, if I may mention two things. I was asked in the mid-1990s to set up a haemovigilance system for the UK. And in 1995, we launched the Serious Hazards of Transfusion scheme, known as SHOT, which was only the second national reporting system in the world for serious complications, errors, and infections resulting from transfusion. It started as a voluntary activity, and understandably, there was considerable nervousness at hospitals who were being asked to report their errors to SHOT. As confidence grew and people realized that the evidence coming out of SHOT could be very useful in informing policies for blood safety and for reducing errors, SHOT became a very welcomed activity, particularly as a source of recommendations and transfusion education. And in fact, later on, participation in SHOT became mandatory for the accreditation of a hospital laboratory. In SHOT, we were greatly helped by the support of the British Society for Haematology and other professional societies, as well as all of the Royal Colleges from pathology, surgeons and physicians, and so on, that encompassed all the professions that were involved in the administration of blood. I think today SHOT is recognized as one of the leading haemovigilance organizations in the world, and it's an integral part of transfusion practice in the UK. The second thing is that I was fortunate enough to be a co-founder of the NHS Blood and Transplant Clinical Trials Unit, which we set up to run trials of blood components and thus gain evidence as to when blood transfusion would be useful for patients and when it was better not to use it. Prior to variant CJD, it would be fair to say that blood was used fairly widely without much evidence of when it would be beneficial. But the threat of VCJD and other infections in the 1990s really changed the focus to the better blood transfusion initiatives and patient blood management. But there was a great lack of high-quality evidence and trials for the use of blood components. The trials unit has gone from strength to strength and has resulted in publications in top journals of trials in newborn babies, in haematology patients, sickle cell anemia patients, and in trauma. And I think there will be still a need for these trials to continue into the future.